All right, we're here with Patricia, and Patricia's about to start her procedure with Dr. Davis. So Patricia, tell me, how long have you had the knee pain?
Since back in the latter part of the 80s.
And now you're recently experiencing hip pain.
Yes.
And how that's all related. When did the hip pain start?
The first part of February.
Okay. So, have you seen any other doctors for this?
No, ma'am.
All right, so this is your first attempt to get this corrected. Okay, so I know we had discussed earlier, what is your discomfort level today?
10.
It's getting to the point where it's unbearable and you just can't get up and move around.
No.
So it's keeping you from doing just about anything.
Right.
All right, so we got to get you up and moving. All right, so I'm going to have you go from sitting to standing for me, Patricia. Did you have any discomfort there?
Just when I stand with my feet flat.
And where are you feeling it at?
Right now it's in the hip.
It's in your hip. Okay. All right, so I'm going to have you take a step or two forward, and we're going to do that squat. We're going to see how far you can go down on the squat, okay?
Okay.
Arms straight out in front of you. How low can you go?
I don't have any pain, but that's a little further my leg will let me go.
Okay, then slowly stand back up. And what is it that you feel when you do that? Is it a tightness? Is it like it won't let you bend, or?
Yeah, it's a tightness.
Okay. So it won't let you bend any more than that?
No.
Okay. All right, so we're going to go up and down the stairs for me. Patricia, I want you to hold on to that railing.
Watch out for that parking thing.
I know. Thank you.
Now, can I hang on?
Yes, please do. I want you to hang on.
Now I'm getting pain on both sides.
Okay.
Hip and the knee.
Okay. And where is it hurting on the knee?
Main knee right in here.
Is it like underneath the kneecap? Behind it?
No, it's up front.
Okay. All right. Continue. Come on down. And then when you get to the bottom, we're going to go back up to the top, because we're going to see which is more difficult for you, going up the stairs or coming down. Okay?
Okay.
And
You want me to turn around and go back?
Yes, please.
That's how I usually do it.
Okay. And you're using your good knee to go up the stairs?
Yeah, that's what it's supposed to be, is my good knee.
Okay.
But
All
that's
right.
my bad hip.
Okay. That's your bad hip now.
Right.
Okay. So where was it worse, going up the stairs or coming down?
Worth coming up because of the hip.
Okay. And that's where the pain was? It was in the hip?
Yeah.
Okay. All right, let's get you in to see Dr. Davis. All right, we're back with Pat. All right, Pat, let's do those exercises again. I'm going to have you stand up. All right. Let's do the squat. Whoa.
Oh, that's good.
That's good.
That's good.
All right, let's go up and down the stairs.
See if I can do this without.
Look at that.
Look at that.
Look at that. Let's go back up.
Yes. Yes. Yes.
So, Patricia, what have you noticed? What kind of changes have you noticed?
No pain.
No pain. That is wonderful.